Hi there, I'm Dr. John Tickel and I'm an ambassador with Salts of the Earth. And the reason I'm delighted to be an ambassador is this: there is science behind the natural therapy. It's all very well to say, aha, we've got a non-drug therapy that works, and that's a fact, but it's the controls, the procedures, the sensors, it's the environment. And it works in association and in conjunction with regular medication that our children and we are on today for our respiratory diseases, our asthma, our bronchitis and our chronic. All smokers, 90% of smokers have chronic obstructive lung disease. They can't breathe properly. I mean, what a worry is that in our modern world? So let's look at the research. Now, there are various professors, especially Professor Chervanskaya, who have done a number of papers and research projects on halotherapy, and halo is Greek for salt. So salt therapy is the inhalation of tiny particles of sodium chloride, that's salt, in air, where people start to feel better, breathe better, sleep better, and the medical science shows us that there's a reduction in inflammation in the bronchial pathways, and more than that, there's an increase in what we call mucociliary clearance. That means simply that the sputum, the sticky mucus in your lungs, can be coughed up easier. That's fantastic. So people start to say, wow, I feel good because I'm breathing better and I'm sleeping better and my life is great. So the science is such that the papers have proven what I'm talking about. And if you don't mind, I'm just going to read a paragraph from the latest scientific research by Professor Chervanskaya in Europe. And I'm reading this: the clinical state of 85% of the patients with mild and moderate bronchial asthma, that's the asthma that we get, 75% of them with severe asthma, and 98% with the chronic bronchitis, bronchiectasis, and even cystic fibrosis that the little kids get. These people improved, over 3/4 of them improved after halotherapy. That's breathing in sessions, half an hour, 45 minutes, where you're breathing natural salt air in a beautiful environment. The patients were then examined 6 and 12 months after their halotherapy course, and there was no aggravation in any of the disease. In the 3rd, the 9th, the 12th month, they were all feeling better. And it's interesting that all the tests and scientific research shows the reduction in white cells in the inflammation, and it increases the mucociliary clearance so you can cough up your sputum easier. The great thing from my point of view, and I'm a medical doctor who prescribes drugs. Now, halotherapy is not taking the place of your medicine, but it works in conjunction with that. And we and your doctors work together, because I'm a medical doctor, and the corresponding repartee, consultations and medical scientific tests show the benefit of using one therapy with another. Drug therapy, natural therapy. So natural therapy in this case does have the scientific backing, and I'm here to show you that research if you wish, and the benefit is substantial for 90% of patients plus. That's brilliant. Thank you.